Hello and welcome to one of the first lectures in your 8-week quad course on evidence-based practice in healthcare. My name is Dr. Cosby and I get the privilege of talking to you about the importance of evidence-based practice, not only in healthcare or kinesiology, but truthfully within each of your respective fields. We hope that by the time you finish this lecture, each of you will have a better understanding of what evidence-based practice means, not only to healthcare, but what it means to you in your respective field. So we get excited when we teach this course because this is one of the only courses that every graduate student within the College of Health Sciences is required to take. So we typically have 150 students co-enrolled in this course. Those students include athletic training, occupational therapy, integrative wellness, the Masters of Science in Kinesiology, Strength and Conditioning, and Clinical Exercise Physiology concentrations. Biomechanics students are also in this. And then last but definitely not least, our Physician Assistant Studies students. So you can see we are going to try to live what we are preaching in the next 8 weeks about how important it is, how vital it is for you all to grow into evidence-based practitioners by the time you graduate from your respective programs. So I want to start with this next slide so that you can see kind of all of the programs that are represented in this course. And then I'm going to talk you through, in the next 8 to 10 minutes, talk you through how evidence-based practice kind of, in many ways, informs clinical practice in athletic training, strength and conditioning, clinical exercise phase, integrative wellness, physician assistant studies, and occupational therapy, in hopes that by the time you leave us, you understand what this means to you and to your field. And why are we doing this? Because we've taught this class for almost 10 years, and we've had students say at the end of this class, we don't understand how evidence-based practice applies to us. And so we're starting this class this year with this lecture so that we can really start to kind of plant the seed of what it means to be an evidence-based practitioner in each of these healthcare programs. So let's start with what evidence-based practice is first, right? And on the right hand of this slide, you have kind of the three components that are crucial in what we call is evidence-based practice. And the first one will come natural to all of you. If you're not already clinical experts, you will be when you graduate or sit for your boards at the end of your program. But evidence-based practice requires individual clinical expertise, or another way to say that, clinical experience, right? Years of clinical experience. It requires the best external evidence. So we're going to spend a lot of this time learning how to search databases, learning how to use Boolean operators or terms to help us search for the best external research / manuscripts. And then last but definitely not least, something that is typically newer to students in this course is that evidence-based practice also includes consideration for the patient's values and their expectations about the treatment or the intervention that you're going to give to them. And so when we have these three components, what we know when they're combined is that it improves patient outcomes. It enhances and improves your clinical decision making overall, and it keeps us current and science-based, which to me is really important as you continue on in your healthcare fields. So there are 5 steps to evidence-based practice, right? If you really truly want to practice and be evidence-based, here are the 5 steps, and most often they happen in order. And step 1 for most people is relatively easy, right? It just requires you to be curious about something, right? And that curiosity is usually sparked when you meet a group of clients or patients, right? That you typically can't fix, or for some reason they have plateaued and they aren't getting better, right? And so you start to ask questions like, what can I do? What treatment can I give? What medication can I prescribe, right, to this patient to continue to improve outcomes? And so the first step in the evidence-based practice process is really just to ask a clinical question, to convert information need into an answerable clinical question. Once you do that, once you have that question, right, then the next step then is to start to search the literature. For some of you, that looks like typing into ChatGPT or another AI platform. For others, it's going right to google.com and trying to search for things. But in this process, what you're really trying to do is acquire or to track down the best evidence for asking that curious question, right? Asking that clinical question. We are hoping that step 2 will look a little bit different. That yes, you will use ChatGPT or your AI engines and maybe your Google, but we are hoping that we expose you to more databases that might yield more evidence-based research articles that are, I would say, valuable and allow you to apply it to your clinical setting. And step 3 is then finding that research, right? Those research articles, and then appraising it, because we know that not all research is created equal, right? There's researcher bias, for example. There are non-peer-reviewed research articles. And so it becomes important to take the data or the research that you find and then to do this process called critical appraisal. So in one of your modules, we'll spend a whole week on critical appraisal tools that can be used to assess the strength and the validity and the impact and applicability of your research studies. And the more valid they are, the more impactful they are, the more applicable they are to the patient group that you're working with, what we typically see is the better they are for use in applying that, right? Or integrating that into your clinical setting and into your clinical decision making, which is going to be step 4. And then the part where clinicians typically get too busy because they're working full time and they just don't have time to do that, they can implement or apply it well, but they typically don't go back and evaluate, right? Or audit whether or not that clinical tool that you decided to use, or that intervention that you decided to use, or that rehabilitation technique that you decided to use, you have to then go back and evaluate whether or not it was effective at, I'm going to go back a slide, improving patient outcomes. And then if it does that, then you can say, okay, I'm going to keep using it. And it becomes a cyclical process, right? Back to asking, back to acquiring, back to appraising, back to applying and assessing all over again. I think where we get complacent as clinicians is often in that audit phase. We apply really well, right? Most clinicians are very kinesthetic in nature, so we're good at applying, but actually auditing and evaluating and then going back to the drawing board if it isn't, right? So if in fact the intervention or the rehab plan doesn't work, then we have to re-ask the question in a different way, and then we have to reacquire and reappraise and reapply, and it just becomes a cyclical process that hopefully you get excited about. Trust me, I do when I'm working with patients. So let's talk about EBP in specific healthcare fields. The first one up is athletic training, not because I'm biased or anything, because I'm an athletic trainer, but because it starts with A and A begins the alphabet, okay? So in athletic training students in here, one of the ways that we see evidence-based practice being applied the most is to injury prevention plans. And the most coveted injury prevention plan that is most often reported in the literature are ACL prevention plans, right? We could probably look up 5 different intervention plans for ACL prevention, and not all of them are going to be valid, applicable, or impactful, right? So this becomes a way to take those research articles, appraise them, and decide whether or not that is a prevention plan that is going to work for, let's say, your soccer athletes or your basketball athletes, etc. The other way that we see that is in rehabilitation protocols. There are a lot of rehabilitation protocols that, let's say, are reported for, let's say, ankle sprains. We obviously know ACL sprains. We'll say glenohumeral dislocation or shoulder injuries. And so not all of those are valid. Not all of those are impactful, right? And so we have to weed through those, ask the clinical question. We have to acquire the research articles. And we have to appraise those and then apply them and look at whether or not we had a reduction in ACL injuries, for example. So we can see how evidence-based practice really, truly fits seamlessly into the field of athletic training. For strength and conditioning, I list it next because I think that athletic training and strength and conditioning are really kind of woven together such that athletic trainers typically work with athletes, and we work with them when they're most often injured, and our goal is to take them from injury state back to kind of normative state, right? And then we have our strength and conditioning coaches, which do work with injured athletes, but most of the time they spend a lot of time on maximizing performance once they're healthy, and reducing the injury risk once they're healthy all over again, or before they even get injured, right? So we think about evidence-based practice and strength and conditioning. You all are going to use evidence-based practice to figure out which training programs that are in the literature maximize performance in soccer athletes, in basketball athletes, in baseball, softball athletes, etc. And then which of those reduce injury risk for, let's say, female athletes participating in basketball, right? And so we can see how athletic training and strength and conditioning, we can see how both of these healthcare professions are using evidence-based practice similarly, yet distinctly and different to drive, clinical decision-making. Next is our clinical exercise physiologists. Clinical exercise physiologists most often use exercise interventions that are going to be supported by the research, right? Let's think about maybe obese patients and HIIT training. That's a big one right now in the research literature, right? So they're going to look at which exercise interventions might be effective at reducing heart disease, type 2 diabetes, obesity, might be effective at improving, let's say, pulmonary function after, cancer recovery, right? And the way to do that is to, number one, ask the curious question first, to acquire that research, to appraise it, and then to apply it, right? And to keep doing that cyclical process. In integrative wellness, there are so many ways in which you all can integrate evidence-based practice. What I'm learning about integrative wellness is a few things. It's all about holistic health care and strategies, right? You all are going to be looking for, and that's a very broad term, which could be very specific depending on which path in integrative wellness you're going into, right? So I want to be very careful to say that evidence-based practice will apply differently depending on which route you choose to go, whether that's functional medicine, whether that's health coaching, etc. But overall, our integrative wellness professionals in this course will use EBP to promote holistic health strategies. And those health strategies are slowly starting to be reported in the literature. I would say of the healthcare professionals in the course, evidence-based practice is probably newest in your field, but that doesn't mean that it doesn't exist, right? So an example of that would be like, which mindfulness interventions would reduce stress in patients that have, let's say, high anxiety, for example. Next is EBP in physician assistant studies. Because EBP was birthed from nursing and medicine, EBP in physician assistant studies is probably the longest standing profession in this particular class. And so we have a lot of data to support its use for accurate diagnoses, for treatment planning, patient education. The biggest way that we see this is often in pharmacology, when you're trying to decide which drugs would be best to prescribe to patients with certain illnesses and or pathologies, or which imaging technique might be best to assess, let's say, cancer in a patient, for example. So we see that evidence-based practice probably has been most utilized in the field of physician assistant studies. But again, every other healthcare program in this class certainly has support for the use of evidence-based practice. That said, those healthcare professions where evidence-based practice hasn't been utilized for a long stint, it means that you all get to pave the way for what that looks like, right? You all get to decide what that looks like, and it may be you, in essence, who are the pioneers for evidence-based practice. And then last but definitely not least, evidence-based practice in occupational therapy. Most often we see this being used to design client-centered interventions that improve daily functioning based on the latest research, right? We can think about like hand-based therapy after a stroke. We can also look at this from the perspective of working with different techniques that have been used to work with kids who have autism, whether that's mild, mod, severe, or severe, right? And we can use the data to help drive the different types of interventions. So what I hope is that you've seen that there is precedence for evidence-based practice in each of the healthcare programs represented in this class. Our job over the next few weeks with you all is to teach you how to strengthen your evidence-based skills. So the next week, you're going to move into what does it look like to frame a good clinical question, and you're going to be using something known as the PICO format, so patient, intervention, comparison, outcome. This week, we are also going to be teaching you how to use databases to find good, reputable sources. So we're going to show you how to utilize PubMed, CNOL, Sports Discus, EBSCOhost. We're going to teach you how to navigate our library's resources and to request articles if you can't find them. And then we're also going to teach you how to take what you find and appraise those to determine whether or not they're valid, whether or not they're impactful, whether or not they're free from bias, right? And then one of the last things that we want to teach you to do is to collaborate with each other. So in other words, to collaborate with healthcare practitioners outside of your field. So you'll get the opportunity to interact with each of the 6 or 7 subdisciplines. And we get excited when we think about this, because this is your first kind of opportunity to see what it looks like to be a part of an interdisciplinary healthcare team, if we're doing our jobs, of course. And then my final thoughts on evidence-based practice as we think about this, right? Call it the Cosby thoughts. Evidence-based practice bridges the gap between research and real-world care. We can take something that's very sciencey and hopefully deduce it to something that is more clinically applicable, right? And that requires a skill set that we're hoping that we can give you. And then if you can't tell, even if EBP is new, all healthcare professionals benefit from using EBP to better serve their patients. And at the heart of what we do, no matter which field you're in, I think that's the ultimate goal, right? That we are called to be servants to our patients and to consider their values as we're doing that. So as we look at evidence-based practice across the professions, the question that I first started with, my curious question was, has evidence-based practice been utilized in each of the healthcare professions that we have represented in the College of Health Science? And the answer is athletic training, yes. Strength and conditioning, yes. Clinical exercise physiology, yes. Integrative wellness, yes. Physician-assisted studies, yes. Occupational therapy, yes. Let me say it differently to you. If you leave this class wondering whether or not EBP applies to the healthcare field that you're going into, the answer unequivocally, without a doubt, is yes. The question is, and we'll go back here, will you take what we teach you and use it to improve or hone your EBP skills such that you'll be able to collaborate with interdisciplinary professionals outside of your field? Anyways, I hope this gave you kind of a very small tidbit of why evidence-based practice is important within your field, why it's important within the field of healthcare. But if not, stay tuned, because each of the modules is equipped with information to help build the case that I planted the seed for today in this lecture. We are looking forward to having you all and to getting to know you all in our sync sessions. Thank you for listening.